What do you think the current challenges are in the healthcare industry in the Philippines?
Well, for me, being a member of the largest conglomerate focusing on the hospital industry is how do we uplift it to the next level? But for the other hospitals is how can they catch up with the level of care that is being done by private hospitals right now? Because we have around 6,000 small hospitals within the country who needs a lot of assistance in terms of equipment, in terms of training, and in terms of enhancing their skills on patient-centered care. So the challenge is really how do we uplift the healthcare industry at the Philippine level so that it could be uh, a, dest- a good destination for medical tourism.
When you say uplift, you mean in terms of providing healthcare to more, um, maybe more rural areas, or maybe better healthcare, better service. What do you mean by uplift?
Uplift in three areas. First, uplift in reaching to the poorest of the poor. Uh, Challenges in terms of upgrading the facilities of the rural hospitals, and third is to get accredited to make sure that we are able to attract also international patients because we have good doctors and good nurses in the Philippines.
So, in terms of your hospital, Davao Hospital is in Manila. So
No,
it's no,
Davao
it's not.
Doctors is in the southern part of the Philippines where the president comes from right now, our new president. We are from Davao, and we are the best hospital position to capitalize in the BIMPIAGA, the Brunei, Indonesia, Malaysian, East Asia corridor. And in fact, we started our program already, wherein we offer foreign residency with Indonesians. So there will be exchange programs wherein we can basically be the spark plug in the Asian integration with respect to uh, healthcare integration.
I see. Um, so how is in the southern part of Philippines where Davao is, are there is does healthcare reach all the rural areas or all the islands in the south part? How can you ensure that all these tiny islands get also health care?
In the Philippines, islands are appearing and disappearing. If it's a high tide, we have less islands. But if it's a low tide, we have more than 7,100 islands. As I've mentioned, we have around 6,000 hospital all over the country. But these hospitals are basically located in the urban areas. So there is really difficulty. That's why I think with the use of digital transformation and with the digital age, we can reach them. But right now, those are the challenges.
What trends do you foresee on the healthcare industry in Asia, in Philippines and in Asia as well?
Well, I see more freestanding clinics in order for it to become more affordable and there will be less waiting time. I can see a lot of mergers or buyouts from doctor-run hospital to business business corporation. So there will be a better hospital management. I foresee a lot of outpatient facilities in the malls rather than in a specific area. I see a lot of synergy in terms of consolidating all laboratory facilities into one so that you can bring the price down. I can see centers of excellence like centers for dialysis, centers for cancer, center for specialist care, not hospital based, but these are focus based, wherein there's a lot of population that are affected by those kind of sickness.
I see. Well, have your objectives been met at Hospital Management Asia?
Well, of course. In fact, this is our fifth year. When I started when I started in this healthcare business, we try to make sure that we learn the newest trends. And I brought in 10 people from my hospital, and we learned together. We were in Hanoi, we were in Myanmar, we were in Cebu, we were in Thailand, and now we're now in Vietnam. And we're very excited that Philippines will be hosting HMA next year, and hopefully we'll have more participants in the Philippine society, so that's one way also of uplifting their knowledge with respect to the healthcare industry.
What do you like the most about HMA, about the event, both the conference and the awards?
Well, the learning process as well as the sharing process. Because, the learning process for us, which are more progressive hospitals, are good. But the mere fact that we also share our experience to the less developed hospitals is a self fulfillment to us. Because that's, again, one way of uplifting the level of healthcare within Asia.
Thank you very much for your time.